If you are alone right now, and you suddenly feel a strange pressure in your chest, this message could save your life. In the first 10 minutes of a heart attack, what you do or don't do can mean the difference between survival and tragedy. Stay with me, because the next few minutes matter more than you think. Imagine this. It's a quiet afternoon. No one else is home. Suddenly, there's a tight, squeezing feeling in the center of your chest. Maybe it feels like weight sitting on you. Maybe it spreads to your left arm, your jaw, or your back. You feel short of breath, a little dizzy. You might even think, it's probably just indigestion, or I'll sit down and see if it passes. That thought, waiting, is one of the most dangerous decisions people make during a heart attack, especially after 60. Here's the truth. Most people who survive a heart attack do so because they act fast. The first 10 minutes are critical because the heart muscle is being starved of oxygen. Every minute that passes means more damage. But even if you are completely alone, your actions in those first moments can dramatically increase your chances of surviving. The very first thing you must do is recognize that this could be a heart attack. Heart attacks do not always feel dramatic. They don't always feel like a sudden collapse. Symptoms can be subtle. Pressure, fullness, burning, or discomfort in the chest. Pain that comes and goes. Shortness of breath without exertion. Cold sweat, nausea, unusual fatigue. Sense that something just isn't right. If you feel more than one of these at the same time, do not wait. Do not try to power through it. Do not lie down and hope it goes away. Your next action should be immediate. Call emergency services right away. Even if you feel unsure. Even if you feel embarrassed. Even if you think you might be wrong. Paramedics would rather respond to a false alarm than arrive too late. If you have a phone near you, call emergency services immediately and put the phone on speaker. This is important. Speaker mode keeps your hands free and allows the dispatcher to stay with you. Tell them clearly, I think I'm having a heart attack. I am alone. Give your address slowly and clearly. If you feel weak, focus on getting the location out first. Do not hang up unless they tell you to. The dispatcher may guide you through breathing, help keep you calm, and stay on the line until help arrives. That connection alone has saved countless lives. Now, while help is on the way, there are things you should do and things you must not do. If you are standing, sit down immediately. If you are already seated, stay upright, do not lie flat. Lying flat can make breathing harder and put more strain on the heart. A slightly reclined position with support behind your back is best. Loosen any tight clothing around your chest, neck, or waist. Take slow, controlled breaths. Inhale through your nose for about 4 seconds, then exhale through your mouth for about 6 seconds. This helps calm your nervous system and reduces the heart's oxygen demand. If you have been prescribed nitroglycerin by your doctor for heart problems, take it exactly as directed. Do not take someone else's medication. Do not take extra doses unless instructed by emergency services. Now, let's talk about aspirin, because this is critical and often misunderstood. If you are not allergic to aspirin and you have no medical reason to avoid it, chewing one regular strength aspirin, not swallowing it whole, can help slow the formation of blood clots. Chewing allows it to work faster. This does not stop a heart attack, but it can reduce damage while you wait for medical help. However, do not take aspirin if you have been told not to by your doctor or if you are allergic. And do not take pain relievers like ibuprofen or naproxen instead. They do not have the same life-saving effect in this situation. At this point, you may feel an overwhelming urge to lie down, to sleep, or to just rest for a minute. Fight that urge. Staying alert is important. If you feel faint, stay seated and keep your head elevated. If you begin to feel worse, tell the dispatcher immediately. Do not attempt to drive yourself to the hospital. This is extremely dangerous. Many people lose consciousness during a heart attack. The ambulance can begin treatment immediately, monitor your heart rhythm, and get you care faster than driving yourself ever could. As you wait, unlock your front door if you can do so safely. This simple action saves precious seconds when emergency responders arrive. If you live in an apartment, try to unlock the main door and your unit door. If you cannot move, tell the dispatcher that the door is locked so help knows what to expect. Now, there's something else important that most people never think about. Fear. Fear can make symptoms worse. Fear causes the heart to work harder, when it is already in trouble. This is why controlled breathing, staying seated, and keeping someone on the line with you is so powerful. Tell yourself this: help is coming. You did the right thing by calling. You're giving your heart the best possible chance. In the next part, I'll explain what not to do during these first 10 minutes. Common mistakes that cost lives. A crucial technique that could help if symptoms suddenly intensify while you're still alone. Now let's talk about what not to do. Because in moments like this, instinct can lead people in the wrong direction. One of the most dangerous mistakes is trying to walk it off. Some people believe movement will help relieve chest discomfort. In reality, unnecessary movement forces the heart to work harder when it's already under extreme stress. Unless you must move to unlock a door or reach your phone, stay still and conserve energy. Another critical mistake is drinking water, coffee, alcohol, or taking random supplements. Water will not stop a heart attack. Coffee and energy drinks increase heart rate and blood pressure, which can worsen the damage. Alcohol is especially dangerous in this situation. Not eat anything either. Swallowing food can increase the risk of choking if symptoms suddenly worsen. Some people panic and take deep, rapid breaths. This can actually make dizziness worse and increase anxiety. Remember, slow breathing is key. Long, gentle exhales signal your body to calm down. Now, there's a lot of misinformation online about coughing during a heart attack. You may have heard that coughing forcefully can restart the heart. This is not something you should rely on. Coughing is only useful in very specific, monitored hospital situations. If you are alone at home, uncontrolled coughing can increase chest pressure and make symptoms worse. Focus on staying calm and breathing slowly instead. As minutes pass, symptoms may change. The pain may intensify, spread, or feel different. You may feel an overwhelming sense of doom, sudden sweating, or extreme weakness. These are not signs to wait. They are signs the heart is struggling. If you begin to feel lightheaded or close to fainting, shift your position slightly. Stay seated, lean back, and keep your legs bent. Do not stand up suddenly. Sudden changes in posture can cause a dangerous drop in blood pressure. If you have a smartwatch or blood pressure monitor nearby, do not waste time trying to use it unless emergency services specifically ask you to. Your focus should remain on staying conscious, calm, and connected to help. Here is something incredibly important that many people don't realize. Even if the pain eases, even if you feel a little better, do not cancel emergency help. Some heart attacks come in waves. Temporary relief does not mean the danger has passed. In fact, that false sense of improvement can be one of the most dangerous moments. While waiting, think about your medical information. If you can speak, tell the dispatcher about any known heart conditions. Diabetes, high blood pressure, or medications you take, especially blood thinners. This information helps responders act faster when they arrive. If you are struggling to speak, focus on staying awake. Keep your eyes open. If possible, tap or make noise so the dispatcher knows you are still responsive. Even small sounds can help them assess your condition. Now let's talk about something rarely discussed but incredibly powerful: mindset. The body listens to the mind, especially under stress. People who stay mentally engaged and focused often do better than those who give in to panic or despair. Tell yourself slowly and clearly, I am doing everything right. Help is coming. Stay awake. These words may seem simple, but they can keep you grounded and alert during the most critical moments. In the final part, I'll walk you through what happens as emergency help arrives, how to cooperate with responders, even if you're weak, and how these first 10 minutes can shape your recovery or even save your life entirely. As you wait, listen carefully for sounds outside: sirens, footsteps, voices. When emergency responders arrive, try to respond even if your voice is weak. A small movement, a hand raise, or a sound lets them know where you are and that you're still conscious. When they enter, they may ask many questions quickly. Answer only what you can. Short answers are enough. Chest pain, short of breath, started 10 minutes ago. They are trained to read your condition even when words are limited. They may place oxygen on you, attach heart monitors, or give medications right away. This early treatment started in your home is one of the biggest reasons calling emergency services instead of driving yourself saves lives. Every action they take is aimed at restoring oxygen to your heart and preventing further damage. If you feel embarrassed about calling or worry you overreacted, let that thought go. There is no embarrassment in surviving. Heart attacks don't announce themselves politely. They arrive suddenly and silently, and the people who live are the ones who respect the warning signs. Here's something very important to understand. The first 10 minutes don't just affect whether you survive, they affect how well you recover. Acting quickly can mean less heart muscle damage, fewer complications, and a better quality of life afterward. Waiting, even by 20 or 30 minutes, can permanently change the heart. Many seniors who survive heart attacks later say the same thing. I almost didn't call. That moment of hesitation is the most dangerous moment of all. If you are watching this and thinking this won't happen to me, remember this: heart attacks often happen at rest, at home, alone. Two people who felt fine earlier that day. Preparation is not fear. Preparation is respect for your life. Take a moment after this video to think about your plan. Keep your phone charged and nearby. Know your address by memory. Keep emergency numbers easy to reach. If you take heart medication, know where it is at all times. These small habits can make a life-saving difference. And if you are watching this for someone you love, a parent, a partner, a friend, share this information with them. You may never know when it could save their life. Because when it comes to a heart attack, especially when you're alone, minutes matter. It's awareness matters. And your decision to act could be the reason you get another tomorrow. If there's one thing to remember from this message, let it be this: you are not powerless, even if you are alone. Those first 10 minutes are not about bravery or toughness. They are about awareness, calm, action, and choosing your life. A heart attack does not mean the end. For millions of people, it becomes a turning point, a moment that leads to better care, better habits, and more time with the people they love. But that future only happens if you act when it matters most. Do not wait for pain to become unbearable. Do not wait for certainty. If something feels wrong, trust your body and call for help. That single decision can protect your heart, your independence, and your future. If you found this information helpful, take a moment to share it with someone you care about. One conversation today could save a life tomorrow.